Hi everyone, welcome to 1PM. Just a reminder that you're listening to the summary version of this episode.
So we've got Mr. Black. He's a 70-year-old man from a nursing home who has presented to your tertiary hospital emergency department with some shortness of breath. So please take a targeted history from Mr. Black.
I'd just like to know about if he's got like a cough and the characteristic of it. Is he coughing anything up, coughing up any blood?
Anything else?
Chest pain.
So in terms of associated symptoms, chest pain is very, very important to ask, right? Because things like pleuritic chest pain with pneumonia, chest pain like from an MI, you still want to rule that out, okay? Anything else?
Fever?
Fever, right? Because that helps you to think of infective causes like pneumonia, right? Or if they're afebrile, you may want to think about some other causes like foreign body.
You asked about the constitutional symptoms.
Yes.
So in addition to fever.
And what is your way of remembering
I'm a
constitutional
big
symptoms?
fan of waffle. Waffle is the way to go, guys.
Yeah.
Weight loss, weight changes, appetite changes, fevers / night sweats, and lethargy.
Yeah. And almost for every single OSCE, you could ask those 4 questions.
You should ask
you
those
should.
questions.
When in doubt, ask about waffle, okay? Anything else we'd like to go through? Like, think about respiratory history. What are the
Any
key
birds?
things?
Any birds?
Do you have any fucking
birds?
birds?
Been to India
Any
recently?
birds, dogs, cats?
Travel?
Put them down.
Any travel?
Work, occupation.
Yes. So work history, very important as well, right? Do you have dodgy aircon? Okay. What else is important in work history?
Gardening.
If they're like exposed to fumes and chemicals. and
Yes,
things.
right. So dust, like asbestos, like fine particles, things like that, right? Yeah. So the work history, your pets, a very, very important thing to ask. Anything else in a shortness of breath history?
Travel.
Travel, right? Have they recently come back from a place where tuberculosis is endemic? Classic thing with India,
Or like, have you been on a plane for 14
Yes.
hours?
Yeah. right?
Recent surgeries?
Yeah.
Also calf pain and ankle swelling.
Yes, right. So calf pain in particular, very important to ask because that pretty much rules out a PE. But for purposes of exam, if they don't have calf pain, it's very unlikely to be a PE. Okay. And the last one, which is very important as part of the comprehensive history, can anyone
Smoking?
remember? Smoking history, right?
And vaping. Don't forget that.
Very true. Very true.
True. Now you've done your history. I want you to please outline relevant targeted examinations you would perform and what signs you are looking for in this patient based on the history.
Okay, so with every exam, I would start with a general observation.
Yes, I love it.
See if the patient's alert, well or unwell, in any
Yes.
distress, and then get a set of vitals,
Perfect. That's a general exams done. Now, specifically, what would you like to do?
a respiratory exam.
Yes.
So I would like to have a listen of the lungs and have a tap of the lungs.
So you can say, to be a real smart ass when you're doing your exams, be like, for the respiratory exam, I'm going to be looking for signs of pneumonia, such as coarse vocal crackles, dullness to percussion, and increased vocal fremitures. Okay. Those are just some fancy signs of a pneumonia, right? So what are some classic signs of a COPD exacerbation?
There'd be tripoding, potentially.
Yep.
Resonant on percussion with like sort of reduced chest expansion and a wheeze on auscultation.
And another one is like a hyperexpanded chest, cachectic, pursed lip breathing. These are just like fancy things you can add onto your OSCE. They're not essential, but if you can just quickly blurt them out, being like, for pneumonia, I'm just going to look for crackles as well as dullness to percussion. So next one, heart failure. What are some classic signs?
Edema, peripheral pedal edema.
Perfect.
Might see raised JVP.
Yep.
They might be propped up on some pillows.
Yeah,
They might have
perfect.
some oxygen on them.
Yeah, third heart sound, bibasal creps. Those are things which will be in a prompt, like once they give you the exam findings, or you may have to just briefly mention in an OSCE. And last one, PE. Anyone think of any?
Might be a swollen calf.
Yeah, swollen calf.
Tachycardic.
Tachycardic, yep, great.
Normally, I think on the exam, it's pretty normal, right?
Yeah, except I think you can get the pleural friction rub, which I have no idea. No idea what that sounds like, but if I really wanted to press that internal med position, and if I could actually remember on the day, I would say pleural friction. I have no idea what it actually sounds like, but I can say it, okay? So it's really useful to just know some classic signs for each of those to sound really smart. And now we've done our exam, the prompt then continues asking, can you please list some relevant investigations you would order based on the history and exam? So the OBS, you find out that the patient's febrile, their rest rate is 30, their blood pressure is 120/80, and their oxygen saturation is 90%. On exam, you find crackles at the right base and dullness to percussion at the right base as well. On the bloods, there's raised white cell and CRP, and the urea is greater than 7. And on the sputum MCNS, it picks up Streptococcus pneumoniae. And on imaging, there's a right lower zone, homogeneous
Whoa.
opacification. So can you please outline your management of Mr. Black?
By
Right?
A to E
A
assessment.
to E, yeah. For this patient, they don't appear super unwell, right? So you can probably just use that as a throwaway statement. Like, I'll just quickly do an ADE assessment to ensure they're hemodynamically stable. Now we're going through management. What are some of the non-medical management things you'd like to do?
Position the patient.
Ooh.
Yes,
Educate them about what's going on right now.
but position them how?
Ah, yes. Position them upright.
Yes, you want to get them to do some deep breathing as well, get them to move around if possible, because that probably helps with atelectasis. What are some things you do for medical management?
Give antibiotics.
Oxygen, if he needs it, is set to
Yes.
low.
And those two things are the mainstay, right? I think most people can say oxygen therapy and most people can say antibiotics, but a simple thing to remember is always simple analgesia and simple antiemetics to make sure the patient's comfortable. I would start them on empirical antibiotics based on current guidelines. In Perth, this is what they currently are. So for low severity, we've got
Amoxicillin plus doxycycline.
moderate severity
Benzyl penicillin plus doxycycline.
and high severity.
Ceftriaxone plus azithromycin.
Beautiful. Absolutely beautiful. And then to really show you're a safe doctor and to really get those good marks, okay, we want to add on the DFS, right? The disposition, follow-up, and safety net. So for disposition, what would you say?
Well, depending on their curb 65. So he needs to be admitted
Yep.
as an inpatient
To where?
to the ward.
And then in terms of GP follow-up, okay, imagine that they've been treated in the hospital for a few days and they're on the mend. What would you tell the GP to do?
Smoking cessation, alcohol reduction, and optimizing diet and exercise.
Perfect. And the fancy one, which you can always say?
Cardiopulmonary rehab.
Yeah, don't know what it is. Don't know what to say. Always mention it. What are some preventative health things
Ah,
you would
yeah,
tell the
Vaccinations?
patients? Vaccinations. So what are some specific ED safety net like advice you'd give?
If you notice yourself becoming more short of breath, if you notice any chest pain, you notice any fevers,
Perfect.
or you're otherwise concerned, please present to your ED.
And that's pretty much it. You've got 10 out of 10 on your OSCE now.